My name's Pete Thurley. I'm a radiology consultant at the Royal Derby Hospital. It's important to consider the long-term health consequences when you request a CT scan for several reasons. First of all, the number of CT scans occurring in the UK have increased quite a bit over the last few decades, so roughly 3 million in England in 2012 and over 5 million in 2018. This has had many benefits, including fewer delayed diagnoses and less missed diagnoses. It allows clinicians to rapidly discharge patients, and this is in the context of an NHS with pressure on bed occupancy. It's also decreased the number of negative laparotomies and other more invasive and potentially harmful tests. The downside is that radiation exposure is associated with the risk of future malignancy. This is particularly an issue with young patients and female patients, and there are other factors such as the type of tissue that's being imaged, as certain tissues are more sensitive to the effects of radiation. So in Derby, we looked at the awareness of risk of ionising radiation. We performed a survey of our doctors and found that over a third of respondents had never had formal training in this, and over a quarter significantly underestimated the risk of radiation. We also discovered that not all of the doctors who completed the survey could identify which modalities exposed patients to ionising radiation and which didn't. Once we had the support of the consultant body and the medical director, we added a simple generic message to all CT scan reports, explaining that the scan exposed the patient to radiation and this was associated with the risk of subsequently developing cancer. It was fairly straightforward to add the message using the existing radiology IT system. Two main effects were seen following this. Firstly, there was an approximately 5% decrease in scans requested compared to the control hospital with no radiation awareness message. Secondly, when the survey on radiation awareness amongst doctors was repeated, there was a marked improvement in awareness and knowledge, with the number of doctors making a reasonable estimation of risk of radiation rising from 68% to over 80%. This intervention wasn't without its challenges. There was some unhappiness from some of the clinicians, the main worry being that patients might read the report themselves and become alarmed by the warning. Given if a patient is referred for an investigation or procedure, they should have the risks and benefits explained to them, I don't think this is reasonable. I think it's also important to point out the patient is put at risk by the investigation itself, not the message on the report. This approach could easily be adopted by other NHS trusts. The message is not unique to Derby and can be applied anywhere CT scans are used. Due to the advances in scanner technology, it's likely that the estimation of risks we've used may not be accurate for other sites, so the radiation awareness message could be customised locally. In summary, we've demonstrated that the CT report can be used to educate doctors and potentially improve patient safety as a consequence.